To say I got a surprise for you. Now we are going to see you every week if you would like, because starting next week, it's called Fireside Chat, and it's going to be myself and Murray Abramson. And we are going to put together a little program for you so that you can have somewhere where you can just hang out and chat if you like, or just listen and laugh a little bit. We get funny sometimes, you know. One other thing I want to mention before we start, and that is our speech project. You know, it takes about 20 minutes once a month for 5 months. If you're at all interested, please contact info@everythingals or research@everythingals.org, and we will gladly accept you into the program. With that, I'd like to say that my good partner, Casey, is here tonight, and she is going to introduce our speaker. Casey?
Hi, everyone. I'm so happy that you're here. I'm Casey, a part of Everything ALS, and I'll be introducing our speaker today, Dr. Paul Mehta. Dr. Mehta is the Principal Investigator for the United States congressionally mandated National ALS Registry, which resides within the Centers for Disease Control and Prevention and is responsible for providing medical, scientific, and epidemiological expertise on matters related to ALS. He has been in this role since 2013. Prior to joining ATSDR, Dr. Mehta was responsible for overseeing external research initiatives for the National Center for Environmental Health and ATSDR. Dr. Mehta started his career at CDC as a team leader for the Division of Select Agents and Toxins, where he was responsible for Etiological agent import permit program, as well as conducting audits of high containment laboratories nationally. Dr. Mehta has a Doctor of Medicine from Fatima Medical Science Foundation and a Bachelor of Arts in Biology from the University of Toledo.
Thank you, Casey. I'm sorry.
I was just going to say, welcome, Paul Mehta. Thank you, Doctor. Great to have you here tonight. The stage is all yours.
Great. Thank you, McFlynn, and thank you, Casey, for the kind introduction. My name is Paul Mehta, and I'll be talking about the National ALS Registry this evening. First of all, I want to thank Everything ALS, especially Indu Navarro, the founder of Everything ALS, for the opportunity to speak at your webinar. This is a great honor, and you guys are growing so fast. Everything ALS is becoming bigger and bigger, which is great. So we definitely want to acknowledge that. And like I said, thank you so much for the opportunity to go ahead and speak at your webinar this evening. My talk is going to be about learning how you can join the fight against ALS. I'm the PI of the National ALS Registry, and let me go ahead and get started. I have no disclosures, and this presentation is going to go ahead and go over how you can join the fight against ALS and why the National ALS Registry is important and why you should join, as well as the National ALS Biorepository, which is part of the registry, why that is also important and how you can join that as well. We also have information on clinical trials and epidemiological studies that you can be part of, as well as risk factor surveys, which patients can take when they actually join the National ALS Registry. I'll also be talking about the demographics of ALS, who gets ALS in the US, as well as the important funding research that we do, as well as the publications as well. And at the end, I'll be happy to take your questions. So just very quickly, this just right here is just kind of a graphic to show exactly what we do here. We do a lot more than just count ALS cases. So it's very important to look at the epidemiology of ALS, who gets ALS, and so forth. But we also look at the why. Why do they get ALS? And that's very, very important. That's where the National ALS Biorepository comes in, as well as research as well. We fund a number of research partners, which I'll be going over this evening. And that's really important to kind of figure out the etiology regarding what causes ALS and the risk factors associated with ALS. We also work with partner organizations such as Everything ALS to go ahead and get the word out about ALS. As a clinician, sometimes as in terms of the attention ALS gets, I wish there was more attention for ALS. There was a discussion earlier before we got started about COVID-19 and the vaccine and so forth, and how that got so much more attention. ALS, in my personal opinion, I feel should get a lot more attention than it does. certainly in the area of research and so forth. That's very, very important. And just kind of continuing on the slide right here, we also have survey data that we do and we collect from persons with ALS, which is really, really valuable. And then we also have something called the research notification mechanism, which allows patients to get information on clinical trials. This is not exhaustive clinical trials, mind you, but just clinical trials that we get information from drug companies as well as academic institutions on regarding assistance on recruitment. And more importantly, ALS research counts on you. This is your National ALS Registry. I'm a caretaker of it. And having you join the National ALS Registry is very, very important. Just before, regarding exactly what we do here at ATSDR CDC, I wanted to also mention our federal partners and exactly what they do. Sometimes there's a hodgepodge of different acronyms out there and so forth, whether it's the NIH, CDC, DOD, and so forth. This kind of slide kind of gives you a synopsis of what everybody does in the ALS arena. The NIH, they do a lot of basic research, biomedical research. They look at slowing disease progression. They look at the genetics of ALS, as well as looking at biomarkers. The Department of Defense, they do a lot of the preclinical development of therapeutic agents, which is really, really important. They actually fund a lot of companies out there in small groups which are looking for potentially molecules or components that can potentially have a therapeutic efficacy with ALS. They also look at stability, toxicology, pharmacokinetics, and so forth. Here at CDC, what we do, we like to look at the unknowns of ALS. Why do people get ALS, and what are the risk factors for ALS? So epidemiology is very, very important. And we also measure the public health burden of ALS. Obviously, ALS is a life-changing diagnosis, and it can certainly, when it comes to the public health burden, that burden falls upon the caretakers, the loved ones, and so forth. And that's really, really important for us to kind of look at the public health burden of ALS. And for us, what we do, like I mentioned, is we do a lot more than just count ALS cases, and that's the epidemiology, the who, the what, and the why of ALS, is what I like to say. So why should you join the National ALS Registry? Hopefully, many of you have heard about the National ALS Registry, and we are at cdc.gov/ALS. And it's a very, very simple process of joining. And like I mentioned, we try to find out the unknowns of ALS. Why do people get this disease? And so forth. And so for us, that's the etiology, the potential causes of ALS and the risk factors. So we know there are a number of risk factors for ALS. For example, those who serve in the military appear to have twice the rate of getting ALS than those who do not serve. We want to know why that is the case. We also collect data, we analyze data. And like I mentioned earlier, we also fund research, and I'll be going over a lot of the funding of the research that we do as well. And then regarding the National ALS Biorepository, how that also fits in as well. So first of all, kind of stepping back, how many cases of ALS are there in the United States? So just very quickly, ALS is not a reportable disease in the US. What does this mean? That means unlike a lot of other diseases out in the US, ALS is not reported to public health departments with the exception of one state and soon to be two more states. And I'll go over that very, very quickly. But for example, there are diseases which are actually reportable. For example, tuberculosis, COVID. Those are reported to public health departments, and they in turn report to CDC the number of cases in their backyard. So because of that, there's actually a lot of challenges out there to figure out exactly who is getting ALS. So we actually get the bulk of our data from Medicare and the VA system. But right now, we cannot tap the private insurance bases out there. So, for example, if someone's getting their healthcare through, let's say Kaiser, which is actually pretty big in the West Coast, or let's say Blue Cross Blue Shield or something else. If they're getting it through Part C, we certainly can go ahead and get their data through Medicare Part C. We feel we capture between 80 to 85% of cases of ALS in the U.S., and we're missing cases, and we acknowledge that fully and openly. And the cases we are missing are the individuals who get their care through, for example, their own private insurance company. That's why we certainly encourage patients to come to cdc.gov/ALS and join the National ALS Registry so they can be counted. And we all can agree, one case of ALS is one too many. There must be more that needs to be done, especially looking at, potential therapeutics out there and so forth. So regarding exactly how many cases of ALS are they in the US? Right now, as of 2017, we estimate there's close to 32,000 cases of ALS in the US. which is a rate of 9.9 per 100,000. And we're missing about 14,000 cases. And like I mentioned before, the cases we're missing are persons of ALS who get their care through private insurance and so forth. We just can't capture their data because the bulk of our data are coming from Medicare as well as the VA system as well. And so that's very, very important right there. And also, what's also important demographically, the bulk of our cases are also coming from, for example, white Caucasians and males as well as females. But we want to go ahead and make sure that we also get, when it comes to being counted, African Americans, Asians, that's a proportion of cases we know we're missing. And we work with partner organizations to go ahead and get the message out about having individuals, minority individuals who have ALS to go and join the registry as well. So regarding this number, how do we come up with this number? So the 5,323, first of all, let me just kind of go back very quickly. This is probably a question I'm going to be getting regarding, well, Paul, we're in 2023, you're reporting cases on 2017. Why is that? Because we get our data from Medicare as well as the VA system, we can only move as fast as the data which are available. We have robust data user agreements and relationships with these organizations to go ahead and receive their data. And once we get their data, we'll go ahead and begin the in-house analyses to make sure exactly what is the case and so forth. And sometimes these data are not readily available. Medicare is about 2 to 3 years behind. The VA system actually is a bit better when it comes to having more real-time data. But because these data, there's a data lag, that's always a concern. So we're currently working on 2018, and we'll publish 2018 sometime this year regarding the prevalence of ALS in the US. But just kind of going back to how we came up with these 32,000 cases. So about 5,323 of these were self-enrolled, and these were individuals who came to cdc.gov/ALS and joined the National ALS Registry. And the other ones came from the admin databases, such as Medicare, the VA system, which is the Veterans Health Administration, and VBA, the Veterans Benefit Administration. So those made up 2 of the biggest bulk of cases. And then we applied a model called Capture Recapture, which estimates the number of missing cases of ALS in the US. And for 2017, we estimated about 14,000 missing cases. And that gave us close to 32,000 cases of ALS in the US. Just kind of switching gears regarding the risk factor surveys. When someone comes to the National ALS Registry, they'll go ahead and enter, create a user ID, a password, and so forth. And they'll be given an option to take risk factor surveys. We currently have 18 risk factor surveys that can be taken at your leisure, and you can take them anytime you want. And these surveys really help researchers, not only researchers at CDC, but researchers who get this data externally as well, to kind of figure out the mysteries behind ALS. So we look at occupations. Are certain occupations at a higher risk for getting ALS? Military service, I mentioned, why are veterans at greater risk of getting ALS than non-veterans? Physical activity, smoking, drinking, and so forth. Where did you live? Were you exposed to potential pesticides in the areas where you lived? Are these risk factors? As well as traumatic brain injuries. We also have a disease progression survey, which allows patients to take these risk factor surveys 3 times in the first year, and then as well as in certain intervals the following years, which kind of gives you, it's like an ALS FRS survey or a tool, which allows us to measure your disease progression. And we also have one called an open-ended survey, which allows patients to tell us what they think caused their ALS and what they think causes ALS in general. And this is a qualitative survey. And these surveys, like I mentioned, really help researchers to kind of figure out, what exactly is your story when it comes to your disease itself and so forth. That really, really is very, very important for researchers to get that information. And the biorepository, switching gears, all these data I mentioned right here are also matched to samples in the biorepository. The National ALS Biorepository, what we do, this is a completely free service. So when patients come in, they can register, and we'll send them an information packet, and we'll come to the comfort of their own home to go ahead and collect their saliva as well as their blood. And what the National ALS Biorepository does and why it's so important is we look at the genetics of ALS. So certain genes, we know SOD1, C9, ORF72 are linked to ALS. We also look at biomarker identification regarding, is there a certain biomarker that we can look at to see, for example, whether a person has ALS or whether we can measure their disease progression. ALS right now does not have a blood test. There is no definitive biomarker out there that's been validated to say, hey, this person, has this particular biomarker, therefore they have ALS. At this point, there is nothing at this point, there's nothing right now. However, I mean, there's a lot of research being done to look at biomarkers, which is excellent. And that's where we kind of come in to help out these researchers by giving them specimens to go ahead and look at. And we also look at the environmental factors of ALS. For example, heavy metals, lead, arsenic, and others, as well as something called persistent organic pollutants. These are stuff that people are exposed to through their lifetime, pesticides, insecticides, and so forth. And so we want to see if the past exposure to one of these chemicals or one of these metals potentially a link to ALS. And this right here is where I mentioned earlier, all that risk factor survey data I showed to you, it's matched to all the patient's samples. So you have a really, really rich data set, which allows researchers to kind of see exactly, where this patient, where this person with ALS lived, where they actually worked, and so forth. And that's also, like I said, married with their biological sample, which is really, really important to look at the genetics and so forth. And like I mentioned, this is National ALS Biorepository is a user-friendly biorepository. We come to your home; it's completely free. You can even send you a saliva kit if you just want to have a saliva kit mailed to you to go ahead and give us your saliva. We can look at the genetics of ALS. But we also do blood samples, and those blood samples help us to look at a lot more than just genetics. For example, like I mentioned, metals, as well as persistent organic pollutants. This is a completely free service. We come to your home, and we'll go ahead and have a phlebotomist come in and work with your schedule as well to have them come in and take your blood sample. The National ALS Biorepository is one of the largest collection of pristine ALS samples for research in the world. And we currently have over 1,500 samples. We've also partnered with Temple University, Dr. Lyle Ostro, who's a neurologist there. And so they have over 300 postmortem samples. And so we actually help fund their institution to go ahead and get this important research materials out. This right here is a quick schematic of the actual biorepository itself. So we have the in-home collection, blood, urine, saliva. We don't collect urine anymore, but just blood, saliva, and that's added to the biorepository. We also have a postmortem collection. Bone, brain, spinal cord is collected as well. And then those are, like I mentioned, those are all married and all matched the risk factor surveys. And those specimens are then sent out to researchers who request this information. And also just to want to touch upon, we never ever share your name. Everything is very, very private. We only give them only de-identified data sets. So which means there is no sort of patient name. It's just very, very high level information we give to researchers to go ahead and do their data analyses. Just switching topics, we also support participation in clinical trials and epidemiological studies. This is a tool we created, and what this allows is, for example, pharmaceutical companies as well as academic researchers to come to to the registry and ask for recruitment assistance. And this are not all clinical trials out there by far, but this certainly is one of the most. And I'll give you a list regarding the clinical trials we help to recruit for. And what we'll do is a patient will come in, register, we'll go ahead and give them information on clinical trials. An email will go out, and the individual can go ahead and elect to contact the drug company or the academic site that's running this particular study about the clinical trial study. So we never ever share your patient name and so forth. It's always very, very high level, and so it's always up to you if you want to go ahead and participate in these studies. To date, we have over 70 institutions who've actually used this particular tool, and we estimate that we help to recruit literally thousands of patients for these clinical trials and studies. This is just a small snippet of some of the clinical trials out there. We've helped to recruit for AMX 0035, which is now known as Relibrio, which is approved by the FDA recently or last year. That slows disease progression. Amylyx came to us, and we provided recruitment assistance for their clinical trial. Mitsubishi Tanabe Pharma, their orally Darabone, we helped to recruit for that as well. The Atlas study, which currently is going on, that's through Biogen, as well as the Healy platform trials, which are also going on through Mass General Hospital in Boston. We also helped to recruit for all these. And just switching topics regarding the research that we fund. So, like I mentioned earlier, it is really important to look at what causes ALS and the risk factors of ALS. And to date, we've actually funded 24 research institutions who have either done or are currently doing this research, looking at the the etiology and the risk factors for ALS. This past year, we actually funded 2 awards, and we're hoping to fund a few more in 2023. And some of the areas we're looking at when it comes to funding are risk factors, like I mentioned. So, for example, cyanobacteria, harmful algal blooms, which can occur in certain lakes and water bodies. And so these particular cyanobacteria appear to be linked to ALS. We also have researchers looking at pesticides and pollutants, looking at certain biomarkers and genes. We're also looking at the human virome. So we're looking at 400 viruses which are endemic in the body. And those viruses are where we're studying them to see exactly if there's a past viral exposure that potentially could have triggered someone's ALS. That certainly is really important, because there was a study that came out last year by Harvard by Alberto Echeria, who actually is the same individual who's doing this, who found a link between Epstein-Barr virus and multiple sclerosis. So Dr. Echeria is the same individual who's looking at the human virome for ALS. Military service, I mentioned earlier, where we also fund research regarding military service and why do vets have a higher risk of ALS. Traumatic brain injuries and chronic neuroinflammation is another area as well. Looking at the gut microbiome. These days, I'm sure the microbiome people have heard about the gut microbiome that's always kind of in the news and so forth. And so that gut microbiome, we want to see exactly, what do you eat, and the microbiome in your gut, does that potentially have some sort of influential factor either in disease progression or even possibly disease etiology of ALS. We're also taking all the samples we've collected, and we're doing whole genome sequencing as well on those samples with the National ALS Biorepository. Sorry, my slide's not moving here. Yep. Okay. Very good. This right here is a current and past funded institution. So we funded a number of high-level institutions. Harvard, Dartmouth, Karolinska Institute actually is in Sweden, and University of Michigan, Stanford, and so forth. And these are all our current, like I said, current or past funded institutions, which are looking at these risk factors and the research, trying to figure out exactly what causes ALS and why. Just very quickly, so just kind of in closing, the impact of the National ALS Registry, we are the largest database of ALS patients in the US for research. We work with pharmaceutical companies and academia to provide recruitment assistance for clinical trials and epidemiological studies. Our biorepository, we are looking to advance research on biomarkers, genetics, and environmental exposures. It's user-friendly. It's a completely free system. We come to your home to go ahead and collect and get your samples. We fund research. And like I mentioned earlier, we want to figure out who gets ALS, looking at the national epidemiological trends and exactly how many cases of ALS are there in the US. And in essence, we're looking at the who, the what, and the why of ALS. And certainly, this is a very, very small slide set right here, because I want to go ahead and entertain and answer your questions. But everything ALS, National ALS Registry, we have a common goal. We want to find out. We want to first of all find out exactly what causes ALS, and more importantly, we want to have a cure for ALS, and that's really, really important. There are a lot of potential drugs in the pipeline right now, and hopefully there will be a lot more which will get approved down the road for ALS, and that certainly is really, really important. So I'll be happy to entertain your questions at this point.
Hi, Dr. Mehta. Thank you for that presentation. I have a few questions for you that people have asked. The first one is, how can you tell if you are registered in the registry?
So you can always, first of all, you can always check your emails to see if you have an email saying you've been registered. If you've not been registered, you can always go online and go ahead and register again. And then from there, we can go ahead and we have a system to kind of make sure you're not a duplicate case as well. So if you're not registered, you can always go to cdc.gov/ALS and go ahead and register. If you have an email address you use commonly, you can go ahead and reset your password. We'll send you an email to go ahead and do that. And that by itself will let us know if you're in the system or not. So those are 3 ways to kind of figuring out exactly if you're registered or not.
Awesome. And then the second one is, will we be able to receive a copy of the slides?
Absolutely. I can email these slides. I believe the slide set's going to be put on YouTube, if I'm not mistaken, right, McFlynn, I believe.
That's right.
And so this
Yes.
presentation will, so the slides are there, and but I'd be happy to go ahead and email the slides to you guys, and you guys can certainly have them as well.
Well, we'll definitely have them in our library, and that's the most important part, Dr. Mehta. It's a great thing that we store all this information, and what you brought tonight will never be lost. Paul, great presentation. From your perspective, what are the challenges or barriers to get the ALS community to register with the CDC? And how can just a little bit more, and how can the ALS community support your work? For example, how can we get more people to register for the CDC?
Those are great questions. So registering is a volunteer. We don't require anyone to register. It's certainly something that you can do at your, it's not required. But for us, it's important to make sure we can get the information and exactly who's being counted. So it's always a challenge to get individuals to register, because sometimes they may not want to register for whatever reason. They don't want their information shared. Like I mentioned earlier, we don't provide any sort of information or names of any patients to anybody at all. Everything is strictly private and confidential. And so nothing is ever shared regarding the patient names and so forth. The challenges of getting patients to register certainly, can be compounded by the fact, for example, access to internet can be limiting for certain patients as well. Geographically, we know there are limitations to registering. We know certain parts of the country have a higher participation in registering than certain other parts of the country. The state of Minnesota has one of the highest participation rates in the entire country. I like to say the Norwegian or the Scandinavian descent or the Swedish descent in Minnesota is very trustworthy, and they always want to participate in research, which is great. But the other parts of the country don't want to register, and they're kind of like, well, we don't want to, potentially register and give the information. But, for us, it's always important for us to let patients know this is a resource. It's a resource for them to go ahead to be counted, to join the fight against ALS, and to provide their information to help researchers figure out exactly, what causes ALS and why. So that by itself, hopefully, is an impetus to join the registry. And it's a very simple process. It takes about 5 minutes to register. Like I said, those surveys can be taken at your leisure. They can be taken whenever you want, and we'll give you information on clinical trials, as well as the National ALS Biorepository as well. And so this allows researchers such as myself, as well as external researchers. I mentioned Dr. Lal Ostro, who does the National ALS Biorepository out of Temple University, out of the Temple ALS Tissue Core. And that certainly is really important for researchers to look at the biomarkers of ALS, the genetics of ALS. And like I mentioned earlier in my talk, I personally feel there should be a lot more attention for ALS. As an ALS researcher, I'm biased, obviously, but ALS is a life-changing disease, and there needs to be more attention, in my opinion, when it comes to whether it's attention by drug companies out there. I mean, there are a lot of drug companies which are looking at ALS drugs, but there certainly could be a lot more as well. We're looking at potential ALS therapeutics as well. So.
With the registry, is there a charge for private researchers to access this data?
Absolutely not. We are a completely free registry when it comes to data. We will go ahead and send data out to researchers. There is no charge whatsoever to go ahead and request data. The only charge we have for researchers on occasion is for the shipping of samples to them. And that's a very, very nominal fee. That's just something that we do. We're not here to make a profit. This is your registry and so forth. And so what we do is we charge a nominal shipping fee for samples, which are sent to researchers. But there is no charge for researchers to apply to get data and samples from the National ALS Registry at all.
All right. You mentioned the privacy protections once you register. So how is my personal data stored if not?
So your personal data is only accessible by 1 or 2 individuals, and that's it. Even myself, I don't have access to your data. It's really only 1 or 2 epidemiologists who look at the data internally. We're a small but mighty team, as I like to call it, when it comes to the registry. And any sort of data requests we get from researchers, like I mentioned earlier, we do not give your name, we do not give your age. What we do, we actually just give your actual date of diagnosis, so it's more of a range. as in terms, let's say, for example, a range of either 5 years or 10 years. So we don't actually give anything which is very specific. We don't give your address. We don't even ask for your address. We only ask for your city. And so there's something like, where someone can figure out exactly where someone's living for patient privacy reasons, of course.
Thank you.
Do institutions like the VA automatically register people?
No, that's a great question. They do not register individuals. So there was a long time ago, there was a VA registry back in the early 2000s, I believe it was. And when the National ALS Registry was stood up, it was decided that would be the national registry itself also for veterans as well. We don't get any sort of automatic data at this point to be entered into the system. Earlier, I mentioned Massachusetts, which is the only state right now where ALS is reportable to public health officials. We are currently working with them to do a data analysis regarding looking at their data and our data, seeing exactly what's matching up. This past year, 2 other states also passed legislation, Vermont and Maine, to have their own registry as well. And there's also an interest from other states to have their own registry. And it allows researchers as well as public health officials to kind of see exactly what's happening in their backyard. So right now, there is no automatic way for any data to be entered into the registry. We do have a request with the Office of Management and Budget, which does federal data collection activities. And our request is to allow for us to take these data sources, whether it's, for example, some other ALS group out there, and have them be able to give us their data and have that data to be entered into our system so we can make sure everyone's being counted. And that's a request which hopefully should be approved any day now. But that will also allow for us to go ahead and look at data much more broadly as well and help with the missing pieces. We're also, in that request, we're also requesting to release data at the state level too. That's always been very, very a requested item. Hey, can you let us know what's happening in, let's say, in the state of Wyoming or whatever state it may be. So that request, once it's approved, we'll be able to go ahead and provide information on state level data, which I think will be very, very helpful as well.
Thank you. This is a question from Paul. How do I get my sample taken?
So pretty much when you come to cdc.gov/ALS, you go and register. And during the registration process, there'll be a checkbox simply saying, do you want more information on the National ALS Biorepository? You go ahead and click that box and you can, well, that's the only point where we're asking for your address. To go ahead and give your address, we'll mail something to you. Like I said, your address is never ever shared with anybody at all. So that address is only for us to mail you a packet about information about the National ALS Biorepository. And then from there, we'll go ahead and contact you to say, hey, have you received your sample packet? And from there, you'll pretty much decide if you want to go ahead and allow us to come to your home, or you can also email you a saliva kit as well.
Thank you.
So not email, mail you a saliva kit. I'm sorry.
Okay.
I found that the registry at my earlier attempt was not very user-friendly. Has that been fixed?
So one of the things we did when it comes to being user-friendly was earlier on, we always had the issue of password expiration. So we went back to our IT folks and said, listen, we need to have a mechanism where it needs to be much more friendlier when it comes to having these persons of ALS register. So now when someone registers, they have the option of actually setting a password time frame. They can say, my password can expire in 6 months, 1 year, or it can be an indefinite password as well. So that allows an individual not to have to reset their password every single time they kind of go in. We are also changing to change the interface of our dashboard for persons with ALS. So when they actually go in there, they can see the surveys. Right now we have 18 surveys. Those will be consolidated into 5 categories. For example, lifestyle questions, demographic questions, and so forth. So it'll be a bit more manageable. And we're also going to be implementing something about a tool so you can see exactly where or what the level of completion is for your surveys as well. That will be happening sometime this year. We are also waiting for approval from the Office of Management and Budget for that as well, so we can make that change. As a federal agency, we have to make sure they're regarding the burden to the public is not too much when it comes to registering and so forth. And so everything we do, we have to abide by certain collection requirements and so forth. But like I said, once we get these approvals, we'll be making changes on the way these surveys are looking, as well as they're kind of packaged as well.
Thank you. Paul, can you take your slideshow down so we can see everybody?
Oh, absolutely. There we
There
go.
you got it. Thank you very much. I'm on a drug trial at KECK, USC, and I am taking riluzole, excuse me, and Radicava and Relivio. Do you still want me to register?
Absolutely. Absolutely. Keep in mind, I mean, you are in a clinical trial. We can still provide you information on future clinical trials, but more importantly, by you registering, that will give us information about your ALS story. Where did you work? Where did you live? And that really helps us out to kind of figure out, those missing pieces behind ALS. So even though you could be, in a trial, we certainly would encourage you to go ahead and register. And this way, like I said, it allows us to have you be counted, more importantly, and have you tell your story to us. And this way we can go ahead and share your story anonymously to researchers out there who could go ahead and help us help us solve the mysteries behind ALS.
Perfect.
I've been registered for years, but no longer get emails. Do you know why that is?
You may have, for example, said you no longer want any emails, but if you want to go ahead and have those emails come back to you, you can just give us a call or send us an email, and we can make sure that you are on those email lists.
Thank you. You mentioned the privacy protections. I will have once I registered, so is my personal data given a code name instead of my name?
That's a great question. Yes, you are given a code. So we do give you a code. So and that code is we call it internally a Reg ID, so registration ID, and that Reg ID is given to everyone. And if you're in the biorepository, we give you a Reg ID as well as a Bio ID as well. And those are married together, and so that's correct. So that's a great question. Yeah, we give everyone an ID, which is very common across any place if you were to sign up for whatever. I'm sure your bank has an ID on you as well, and so forth. And so it just allows us to go ahead and kind of look at you through an ID as well. And then we also have something called the GUID, Global Unique Identifier. I'm not sure if you've heard of that before, but the GUID is also used commonly. It's through Neurobank. I believe they call it the Neural Stamp. But the GUID allows us to look at a person with ALS anonymously and track them through various, for example, clinical trials. So if someone wants to request the GUID from us and the GUID is available, they can look at that, let's say that person with that GUID unique identifier, and they can see exactly what clinical trial they were in and so forth. And it helps researchers to kind of see exactly what's happening, disease progression, and so forth.
How easy is it?
Go ahead.
How easy is it for researchers who want to study the data to have access?
So it's an application process. We want to make sure any application we get from researchers is reviewed thoroughly by internally as well as by our research committee. Because data are valuable, and we don't give data out willy-nilly. It has to be meritorious. It has to be something that is an efficacious study, a study that's going to be hopefully proven to have an impact. And so we go ahead and review the data, and from there we'll go ahead and if it's approved, we'll go ahead and send out the data to the researchers. But keep in mind, we work with researchers across the country as well as across the world, and we want to make sure everything that's submitted to us is like I said, is an important study. These are valuable data. It's your data. We want to make sure it's given out, in a very, very secure as well as a very, very safe manner.
Thank you. In the state registry, do you break out the data for states and distribute that info to the states already?
No, we do not do that. So once we get approval, we're hoping to go ahead and have state level data available, so you can see exactly the number of cases in each state. And that's going to be really, really kind of unique to say, hey, this particular state's got more cases in this state and so forth. Obviously, proportionally, California will probably have the highest numbers of cases only because it's the largest state in the country, right? So with one of the largest populations. So that's proportionally, you're going to most likely see that. But regardless, you'll be able to see exactly who's getting ALS when it comes to race as well as gender, in that particular state. We're not going to release any names, obviously. It'll just be very, very high level data, but it will also give exactly information about what's happening at the state level. We also are hoping to partner with states such as, for example, Vermont, as well as Maine, as well as Massachusetts down the road, where potentially they could share their data with us, and we can have their data come into the National ALS Registry and have that case be counted.
Thank you. Casey has the last question of the evening.
I had genetic testing through Synapticure. Is that the same testing you offer?
Synapticure is an organization that's going to go ahead and do your genetic testing, and they'll give you the information back to you on your genetic results. We do genetic testing through the NIH, and that what we do is we'll first genotype you, and we'll also do a whole genome sequencing as well. The genotype allows us to see exactly what particular gene a person may or may not have. So for us, our genetic data are not shared with anybody. It's only shared with researchers. We don't offer genetic counseling, therefore we can't share genetic data back to the person with ALS. That's one of the limitations. But Synapticure is an organization that can do genetic testing to see if you have a particular gene or not for ALS.
Thank you. Just one more short one. What do you think? Is it not smart for the states to be spending on this and duplicating efforts?
Well, states have their own priorities, and as a federal organization, we don't tell states what to do. It's state-based initiatives when it comes to stuff like this, and they can certainly decide if they want to go ahead and pursue this. The information we provide to states is just what we do here at the National ALS Registry. So if a particular state wants to have their own registry, it's certainly up to them. My take is certainly having more data and seeing exactly what's happening in your backyard is always important. The data we're currently releasing is on a national level, soon to be as well as at the state level once we get approval. But I think states such as Massachusetts, where they can see what's happening in their backyard, I think does allow more granular data to be evaluated and analyzed. But obviously, we are the National ALS Registry, so for us to have data nationally is very important, and having state partnerships are also very important too. But at the end of the day, it's always up to the state if they wish to have a registry or not.
Wow. Thank you so much for this tonight, sir. Your information went straight to the brains of all of us, and our little file cabinets now have all this inside. It's amazing what we can remember because it's important to us. So just want to say thank you for your time.